All right, so hopefully you watched that video on the vocal folds and how they change shape based on the sound that you're making. Now we're going to start in on some more histology. All right, so again, you would have seen this in lab, but it's always good to see it twice. So I'm going to hide me so you can get a better view. All right, so what you're looking at in lab is basically a transverse section through the trachea, and you're probably only seeing like a small little area like that. All right. Oops. Trying to advance my slide. It's tricky. Right. So you would have seen ciliated pseudostratified columnar epithelium lining the inside part of the trachea, right? And then that hyaline cartilage is what's making up the tracheal cartilage, and hopefully you remember that from 201. And then on the back of part of the trachea, right before the esophagus, sort of closing in that C-shaped ring, is the trachealis muscle. All right. So basically, when you're taking a breath of air, what you're seeing here, you're taking a breath of air in, it's going through the trachea, and then obviously you have two lungs. I think we all know that, right? So it's gonna split. You have a split in the trachea, and that simply is going left and right. Remember, this is anatomical position. It's an anterior view. So we're going left and then right. And those are the primary bronchi. Okay, so again, we're simply splitting into the primary bronchi going left and right. And then from there, these are still very large tubes, so they're going to divide. And then the next division are going to be, so you have primary, which is like 1. So secondary, simply the next division. They're the second division. So you have secondary bronchi on both sides. And then after that, you have what are known as tertiary bronchi. It's the third split, tertiary, right? Again, you have multiple ones on the different sides. And then after that, you're getting into bronchioles. And then bronchioles will keep splitting until, and at that point you don't give them many different names. They just keep splitting, splitting, splitting until they do not split anymore. And those are called terminal bronchioles. Okay, the only other structure on here of note is something called the carina. So there's a special shaped cartilage. It kind of looks like underpants, sort of. And that is basically a special cartilage where the primary bronchi will split from the trachea. Sorry, trying to get my slide to advance here. Come on. All right. All right. Again, if you remember back to 201, we talked a bit about membranes back then. You have membranes around the lungs as well as pleural cavity. And then there'll be a surfactant, there'll be a fluid in between them. This is going to be important to make sure that the lungs are not sticking to your rib. Okay. Visceral pleura covers the lungs. Parietal pleura lines the actual rib cage, and and then the upper surface of that diaphragm as well. Okay. All right. So just some basic anatomy. You have the apex. So whenever you have an apex, it's just the tip. So for lungs, the top, kind of the pointy part, I guess, is up top. We have then 3 lobes on the right-hand side, 2 lobes on the left-hand side. So you have a superior, inferior, middle lobe on the right, and then you just have a superior, inferior lobe on the left. Separating the 2 lobes on the left is the oblique fissure, oblique because it's at an angle. And then on the right, you have the oblique fissure, but then you also have a second horizontal fissure as well. Last bit, on the left-hand side, you have a little sort of divot in the lungs. That's the cardiac notch. Remember the heart kind of sits at an angle in the chest cavity, so that notch is there for the heart. Okay. So here you're seeing in this image a terminal bronchiole, and then from there it basically it's no longer, well, it still branches, I guess, technically, but as a bronchiole it does not branch anymore. And the splits that you're seeing now, we're going into the respiratory bronchioles, again so called because you can have some gas exchange. It's made up of a simple squamous epithelium. And then you have ducts coming off the respiratory bronchioles, leading into the alveolar air sacs and then the individual alveoli themselves. I think of it, if it helps like to visualize the differentiation, it's kind of like a cluster of grapes, right? So you've got that thick grapevine, and then you have like the individual sort of like little branches of clusters of grapes. So think of it that way. It might be a little bit helpful as far as these terms go. Okay. You can see a sac is 2 or more alveoli sharing a common opening. That's how that's defined. All right, let's just take a quick super in-depth look at one of these alveoli, or an alveolus, singular. Kind of a nice image you're seeing. So here's a single alveolus, and you see there's lots of capillaries surrounding it. We have this simple squamous epithelium making this up, and you can see there's gas exchange occurring because there's very little distance. And we'll see there's a couple of different types of cells associated in these alveoli as well. All right, so type 1 cells are, again, the simple squamous epithelium where the gas exchange is occurring. Type 2 cells are called septal cells, so you see one in the image right here. It has microvilli, and these cells are producing surfactant, and that surfactant is going to be important. It's like a slippery fluid that it's thinner. It's much thinner than like a mucus would be. A mucus would be bad because that would inhibit gas exchange from occurring. But this slightly slippery fluid simply coats the inside of the alveoli, so when you breathe out and they deflate, they don't just kind of stick to one another. Like, you guys have probably blown up a balloon before, right? Like when you just first take the balloon out of its package, sometimes it's even hard to blow up, right? Because the sides are sticking to one another. That's what you do not want in your lungs. If you had surfactant in there, they wouldn't stick. It'd be very easy to blow up a balloon. Okay. And then there are what are known as alveolar dust cells. So that's the one here in this green. Those are simply macrophages there to take away any kind of debris. All right. How does that sound? Sound good? Any questions? I'm actually going to stop the video here because it's kind of another break point. So it's a shorter video. Let me know if you have any questions, either email or in class. All right, see you next time.